Hi, I'm Dr. T, and I'm a pediatrician. On Ask Dr. T, I answer health questions from teens. Questions ranging from safe sex to self-love to questions about body parts. Let's get this episode started. All right, on this episode, we're talking about penis lumps and bumps. All right, first question. Why do I have small white bumps on the shaft of my penis? Some of them have hairs coming out. These are very likely fordyce spots, which are basically enlarged oil glands. So oil glands are all over our bodies and on the penis and on the scrotum skin, which are places where a lot of people notice these fordyce spots. Usually those oil glands don't have hair with them, but sometimes they do. And so it's quite possible that you do have some hair that come out with them. Now, fordyce spots are nothing to worry about. They are very, very common. Lots of people have them. And they just look like kind of white little pimples. Sometimes they can be a little yellow colored, but just little pimples. Nothing to do about them. They're totally fine. Not a sexually transmitted infection. They are very, very normal. Second question. I have these little white bumps on my penis, but if I pop them, white stuff comes out. How can I deal with them? So these are going to be fordyce spots again, but popping them is not the right way to deal with them. One, they're going to come back. Two, popping them is painful, and that can lead to infection or scarring. So you don't want to pop them. Really, there's not a whole lot to be done about them because they are just normal benign oil glands. Nothing to worry about, truly. So many people have them, but try not to pop them because you might actually make the situation worse. And having an infection on your penis skin is not pleasant, I would assume. Third question. Hey, I have these white spots underneath my penis tip. What can they mean and how do I treat them? Alright, so I'm going to draw us a little diagram here. Here's the head of the penis, and here's the shaft, okay? So underneath the head of the penis here, it's possible that you can have some skin bridging or a thin layer of skin that connects the head of the penis to the shaft. Now, sometimes you can get smegma, which is essentially dead skin cells and debris and a little bit of oil or mucus that all kind of clumps up together, is white, and it can get stuck underneath those skin bridges. And those create what are called inclusion cysts. They are nothing to worry about. And that skin that is covering those inclusion cysts actually thins out as you go through puberty, as well as the more and more erections that you get. So inclusion cysts usually go away. They'll slowly, that skin will thin out and allow them to open up and release some of that smegma. If you are through puberty and have had plenty of erections and you still have some inclusion cysts, you can talk to your doctor, and there are a couple things that you guys might be able to do to help get those inclusion cysts away, but nothing to worry about. Fourth question. I have bumps around the head of my penis, and I think they're pearly penile papules. What can I do about them, and what should I tell my girlfriend? Okay, so similar location to the inclusion cysts, but instead of being white, they're going to be sort of just looking like fluid-filled little sacs. Pearly penile papules can happen both to circumcised and uncircumcised penises, although they're a little bit more common for uncircumcised penises, but they are totally normal. Nothing concerning about them. So one, what you might want to tell your girlfriend is that they are not a sexually transmitted infection and you can't spread them. They are just for you. The other thing is that you don't want to do anything to them. So don't pop them, don't rub them, because that can be painful and you can break the skin and cause scarring and infection. They may go away with time, but If you are a little bit older, or if you're really self-conscious about them, you can see a dermatologist, and laser treatment is often the main course of treatment for pearly penile papules. So don't worry about it, not sexually transmittable, but if you feel bad about it, you could talk to a dermatologist. I don't think you should feel bad about them though. They're totally fine, totally normal. Lastly, I'm going to erase this. Lastly, I have one red bump on the shaft of my penis. It doesn't hurt or itch. I am a virgin, but I'm worried about what this might be. Okay, well that's a tough question. One, it's reassuring that you are a virgin, because otherwise lesions on the penis would be either syphilis or herpes. So it's good that those are out of the question. Now, other things I would ask you would be, do you wear an athletic cup? And it could be some of the friction that causes a little bit of a lesion on the penis. It could be, tight underwear or the type of detergent that you use to clean your clothes, and that might cause a little irritation, or what we call contact dermatitis. And so I would look into all of those things. If it doesn't hurt, one thing it could be is potentially just a kind of a popped capillary, or it could be a birthmark. I'm not sure how long it's been there, but if it doesn't sound like any of those, you can look into, your athletic cup and maybe a little bit more cushioning, and potentially trying a different detergent. If the lesion is open, you can apply a little ointment, like an antibiotic ointment, and see if that helps with healing as well. But it doesn't sound like anything to be worried about from a sexually transmitted infection standpoint, but it might be worth showing a doctor if it's been there a while and you're worried about it. So those are our penis lumps and bumps. And remember, if you have a question for Ask Dr. T, you can either respond in this video or submit through my website, askdrt.net.